Welcome to another Inside Lyme podcast. You are listening to a show dedicated to discussing actual cases. Dr. Daniel Cameron has been treating adolescents and adults for more than 30 years. He feels that the best way to get to know Lyme disease is through reviewed actual cases. Please remember that the advice given is general and not intended as specific advice as to any particular patient. If you require specific advice, then please seek that advice from an experienced professional. Now please welcome Dr. Daniel Cameron.
Welcome to another Inside Lyme case. I find the best way to get to know Lyme disease is through reviewing actual cases. I will be discussing how to remove a deer tick from an 8-year-old girl's eye. Jerome and colleagues first discussed this case in the journal Case Reports in Ophthalmology in 2020. Quote, the patient's mother reported noticing a small foreign body protruding from her daughter's eyelid, which was increasing gradually in size over the course of 5 days, writes Girotti and colleagues. She was, quote, a slit lamp revealed a large tick, deeply anchored to the right upper eyelid, writes the authors. The girl had visited an animal farm as part of a school trip a few days earlier. The doctors removed the tick. Quote, our surgical approach hereby included total excision of the tick with its attached eyelid, wrote the authors. The pathologists identified the tick as an Ixodes species, more commonly known as a deer tick. The authors posted a clear picture of a hugely engorged deer tick in an open access journal. The deer tick and the girl's right periorbital swelling and redness with eyelid ptosis are shown in the picture. Ptosis is when the upper eyelid droops over the eye. Case report and pictures are available for free on PubMed. The risk of Lyme disease from an engorged tick can be as high as 20% in endemic areas of the United States. The authors stress the need to, quote, consider antibacterial prophylaxis following a tick removal, as ticks are blood-sucking ectoparasites and vectors of bacteria, viruses, and rickettsia. There was no evidence of Lyme disease or co-infections at the time the tick was removed. The doctors treated the girl prophylactically with oral amoxicillin for 10 days. The authors explained their decision to excise the tick. Doctors have been concerned that compressing the body of a tick might increase the chance the tick might regurgitate toxins and tick-borne pathogens into the wound. The authors were also concerned that the hypostome, or tick head, may stay attached to the host with a granuloma formation. The authors described the classic way of removal of a deer tick, quote, avoiding unnecessary manipulation of the tick, grasping very firmly the tick's mouth parts as close to the skin as possible, and cleansing the lesion after tick removal, end quote. The authors described 2 additional ways of removal of the tick that doctors have been warned might lead to regurgitation of the tick-borne infection into the girl, quote, applying focal heat to induce release and smothering the tick with petroleum to induce release. These are not approaches that I would be comfortable with. What can we learn from this case? Careful removal of a tick is essential. Surgical excision of a deer tick can be effective at preventing regurgitation of tick-borne infections and a granuloma. What questions does this case raise? What is the best treatment for a tick bite to prevent an infection? He was treated with 10 days of amoxicillin. I am not comfortable with a single 200 milligrams dose of doxycycline for a tick bite advised by the Infectious Diseases Society of America, or IDSA. I typically treat for 3 to 4 weeks for a tick bite with follow-up to be sure I have a good outcome. Is the girl at risk of developing a co-infection that cannot be treated with amoxicillin? For example, amoxicillin is not effective for common tick-borne infections such as Ehrlichia, anaplasmosis, or babesia. Will the girl develop chronic illness from the tick bite? Up to a third of individuals with Lyme disease can become chronically ill. We need to determine the best course of treatment for a tick bite to prevent chronic illness. And thank you for listening.
Thank you for listening to another Inside Lyme podcast, a show dedicated to discussing actual cases. Keep in mind, the notes for this episode and all episodes can be found on our website at danielcameronmd.com. Sign up for our newsletter to keep up with our cases. As always, it is your likes, comments, and shares that help spread the word about this podcast and our work. If you can, please leave a review on iTunes or wherever else you get your podcasts. Until next time on Inside Lyme.